We're ready? Okay. Good afternoon. Good afternoon. I'm Mayor Paulette Guajardo. Thank you for joining us this afternoon as we're hosting today's news briefing to update residents on COVID-19 in our community. I want to remind our listeners and viewers today that we have powerful tools to fight against COVID-19 and its variants. We have tools such as testing for all ages, vaccines for ages 5 and up, and booster shots for ages 12 and up. And if you're unsure if you're eligible for a vaccine or a booster based on your age, the age of your children, or the period of time between vaccines, please visit cctexas.com/clinics to find that information. I also want to share that 58.9% of the Nueces County eligible population are fully vaccinated. But I urge everyone to follow CDC guidelines to help prevent the spread of COVID-19 and especially the Omicron variant, which we know is extremely contagious and accounts for 99.9% of the cases in the U.S. today. So health experts continue to urge residents to be vigilant, and the CDC and the World Health Organization continue to remind us to follow their guidelines, which includes vaccinations, regular testing, social distancing, and frequent hand washing, and of course, staying at home when sick as effective ways to combat the virus from spreading. I'm sure you all will hear more a little bit about this shortly, but I want to share that testing is available through the Public Health District Monday, January 24th through Saturday, January the 29th, from 9 a.m. to 5 p.m. at the old Christi Memorial Hospital. To learn more about other testing locations, you can visit cctexas.com and get that information. Because we know that anything that you can do for yourself and for your loved ones to keep you, yourself, your loved ones, or anyone else out of hospitals is probably the most critical thing right now that we're concerned with. Vaccines and boosters, as we know for fact, have played a remarkable role in reducing the number of hospitalizations and severe reactions to this disease. And as your mayor, I want to encourage everyone who wants to get a vaccination to please do so. And I want to remind the community that COVID-19 vaccines are readily available throughout the entire city, and our teams stand ready to assist you in that effort. We must work together to ensure public health for all. And remember that we can help stop the pattern by increasing vaccination rates in the community. If you were vaccinated over 5 months ago, it's time to get your booster. If you need to receive any of your vaccine doses from the comfort of your home, call the City Call Center at 361-826-2489 and register for the in-home vaccination program or the SOS program. Through this program, a Corpus Christi firefighter will visit your home and safely administer the vaccine. We can do our part by following CDC guidelines so that each one of us can help others keep our city safer than it is today. And I want to thank all of our residents who have made the decision to get fully vaccinated. Our health district has administered over 203,000 vaccines to date. So we know what works, we know what to do. Get fully vaccinated, get your boosters, make good decisions, and let's keep Corpus Christi healthy. And now we will hear from our health director, Annette Rodriguez, after the translation from Gabby. Thank you, Gabby.
Quiero recordarles que contamos en la ciudad con medidas de prevención. Tenemos herramientas como pruebas para todas las edades, vacunas para mayores de 5 años y vacunas de refuerzo para mayores de 12 años. Visite www.cctexas.com/clinics para encontrar esa información. El 58.9% de la población elegible del condado de Nueces está completamente vacunada. Insto a todos a seguir las pautas de los CDC para ayudar a prevenir la propagación del COVID-19. Los expertos en salud continúan instando a los residentes a estar atentos y que sigamos sus pautas, que incluyen vacunas, pruebas periódicas, distanciamiento social, lavarse las manos con frecuencia y quedarse en casa cuando está enfermo, como formas efectivas de combatir el virus y su propagación. Recuerde, hay pruebas disponibles a través del Distrito de Salud Pública del lunes 24 de enero al sábado 29 de enero de 9 de la mañana a 5 de la tarde en el antiguo Hospital Memorial. Para obtener más información sobre otros lugares de prueba, visite www.cctejas.com/testing. Las vacunas y los refuerzos han jugado un papel notable en la reducción del número de hospitalizaciones y reacciones graves a la enfermedad. Quiero alentar a todos los que quieran vacunarse a que lo hagan y recordar a la comunidad que las vacunas contra el COVID-19 están disponibles en toda la ciudad. Si necesita recibir cualquiera de sus dosis de vacunas desde la comodidad de su hogar, llame al centro de llamadas de la ciudad al 361-826-2489 y regístrese en el programa de vacunación en el hogar o SOS. En conclusión, quiero agradecer a todos nuestros residentes que tomaron la decisión de vacunarse por completo. Nuestro Distrito de Salud ha administrado hasta la fecha más de 203,000 vacunas hasta el día.
Thank you. Annette Rodriguez, Health Director. I'm going to go ahead and give the COVID-19 statistics for Nueces County. First slide. So, as of January 26, we've had 44 identified Omicron variants in Nueces County, and they have all been of the sublineage BA1. The first Nueces County Omicron case was collected on December 14th. That's still the earliest indication of our first case here in Nueces County. Vaccines, I think, just like the mayor said, especially boosters, continue to offer protection. And Omicron is definitely significantly more contagious than the Delta variant. I think everybody knows the Omicron variant accounts for almost 100% of all new cases in the United States, and that includes here in Nueces County. January the 20th, we had our highest number of positive COVID cases in one day at 1,581 COVID cases in Nueces County. In December of 2021, we had on average 65 cases per day. In this month, January 2022, we've had 824 COVID cases on average per day. So it's almost 13 times higher than what we were last month per day. So there's still a lot of COVID cases in Nueces County. The transmission rate is still very high, so we still need to use all your precautions when you're out. Next slide. So this is a really good depiction of the waves, and I think this is a really important graph. What it shows is that when we started back 2 years ago in March of 2020, we hit our first peak in July of 2020, and that was almost 10,000 cases in 1 month. And then we had the second little wave, and that included the beta variant, but also the gamma and the lambda and some others in that one wave. The third wave, we hit almost 12,000 cases in that 1 month, and now in January, in this fourth wave, the Omicron wave, if you will, we've hit 20,058 cases in 26 days. So very, very transmissible, and we expect to see the rest of the month to continue to rise. Next slide. This basically shows the age breakdown. For just the month of January, you look at all of the cases, and what you're going to see is the largest age group is going to be the pediatrics. So they include the 19-year-olds as well, but 18 and younger at 5578. So that's really where our concern is. And, you know, yesterday we had hospitalizations at Driscoll, and today I think that number doubled. So again, it's very concerning to us when pediatric populations are being affected. Next slide. This actually shows the deaths. And so the good news with the Omicron is that we're not seeing as many deaths as we saw with the other two waves. You can see by this graph that on the other two waves, the number of deaths in 1 month was 180 for both 2020 and for 2021. But if you look at from December to January, you see that it's already more than doubled from 15 to 35. The hospitalizations, I think everybody remembers at Christmas Eve we had 25 people with COVID-19 in the hospital. Then you see on December 27th, 43 people hospitalized with COVID-19. And now you see that we're at 235 individuals here in Nueces County that are hospitalized with COVID-19. The ICUs are also going up, but not as rapidly as the hospitalizations are. Next slide. The total vaccines administered, like the mayor said, 204,091. These are just from the health district that we've administered. Next slide. These are the boosters that the health district has administered, so there are more booster vaccines than just this number, but still, this number is 29,206. So I think for the whole Nueces County, it's probably closer to 80,000, but we still need to get more boosters because that really does give you a difference in protection from the two mRNAs, 25 to 30% protection, and then with the booster, it's closer to 75 to 80% protection. The Nueces County vaccination rates for the total population, 55.3. For the 5 and plus, the eligible population that the mayor mentioned is 58.9. And then if you look at for those 65 and older, the more vulnerable population, that's closer to 81%. This next slide is important because it tells you what's happening with the demand. And so in December, we were doing 2 drive-throughs a week, and we were seeing about 20 people coming through our drive-through. And now if you look at this slide, it says 472 on that first line, people that came through the drive-through. Look below it, 690 people came through, 657. And so quite a lot of more people that are coming through wanting to get tested because they're sick. And so the other important part of this slide is the positivity rate. If you look at 55%, and then you look at the bottom one, 56.9%, so 57%. So the number of people that are positive with COVID-19 when they go through the drive-through is still very, very high. Again, that's because of the high transmissibility that we currently have here in Nueces County. The CDC guidelines for isolation and quarantine. So if you look on my far right, for those tested positive, people still ask me to this day, do I have to go into isolation? The answer is absolutely yes. So it doesn't matter if you're symptomatic or not symptomatic. If you're positive and somebody told you you're positive on your test, you must isolate yourself for 5 days. At the end of the 5 days, for days 6 and 10, you can resume normal activity as long as you're wearing a properly fitted mask, and they even ask that you wear that mask around in your own home. So it's very important. If you're still sick on day 5, then you can't go back and resume normal activity until you're fever-free without taking fever-reducing medication for at least 24 hours. So what if I was exposed? I don't have COVID-19, but somebody else does, and they work closely to me. Do I have to go into quarantine? So no, you do not have to go into quarantine if you're fully vaccinated, if you have a booster, if you're up to date on your vaccines, or if you've had COVID-19 infection in the past 90 days. You just have to wear a properly fitted mask for 10 days, even around your household. And you have to make sure that you monitor your symptoms to make sure you don't get sick. And if you get sick, you need to get tested. But if you're not boosted and you're not vaccinated and you're not up to date on your vaccines, then you must stay home for 5 days in quarantine. And people ask me, what is up to date on the vaccines? So I just received my second mRNA, and it's 2 months after I received my second mRNA. It's not time for me to get my booster. I'm considered up to date, so I would not have to quarantine. The monoclonal antibodies, we all know that Regeneron, we use that for the Delta variant. It does not work for the Omicron variant. So the sotrovimab does work for Omicron, but it's still very limited in supplies here. And so we're really kind of watching those doses that we do have for those really high-risk individuals, like pregnant individuals. Those are the individuals that can get that. And Merck and Pfizer COVID-19 pills are available, but you do have to get your physician to write your prescription for that. So when do I get my booster shot? So did I skip one? Okay, so that's okay. So, there it is. So when do, sorry about that. So when do I get my booster shot? So basically, if you're between 5 and 11, there is no booster shots. They have not been approved for that age group. But what has been approved for that age group is a third dose. But that's only for individuals. These are children that are immunocompromised. So speak to your physician, and if your child is immunocompromised, they can come in and get a third dose 28 days after their second mRNA. So for everybody else, that's 12 years and older, you are able to get a booster. So 12 years and older, 5 months after your second mRNA. 18 years and older, same thing, 5 months after your second mRNA, either Pfizer or Moderna. And 2 months after J&J, you can get a booster. So what are some of these COVID vaccine clinics? And they're here listed. We have La Palmera Mall at the Old Charming Charlie's, the Greenwood Senior Center. We actually started opening this early from 8 to 5 because we know a lot of people enjoy coming out earlier instead of waiting till noon. And then we have also at the former outlet malls in Robstown, at the old Nike store, at the Hilltop Community Center, and both here at City Hall and the Nueces County Courthouse, we're there daily. Our outdoor COVID vaccine clinics are the QSR Legacy. We're in the FIAS parking lot on SPID, and we're also at the Goodwill store on Ayers. Some of the different schools that we're also vaccinating at, just for convenience sake, to make it as easy as possible for these kiddos to get vaccinated, are listed here. And every week, schools will call us and add additional schools, and so we'll keep changing the list so that everybody can get an opportunity. If they're wanting to get their child vaccinated or they're wanting to get vaccinated themselves, and this is a convenient site, they're welcome to do so at this site. And this is where we're testing. We're currently still testing at the old Christi's Memorial Hospital daily, Monday through Saturday. We're also this week in Port Aransas. We were there last week, and we're there this Friday as well. Today we were in Robstown. Also Amistad, the FQHC, is also testing as well by appointment only. So that concludes my presentation. Gabby will translate into Spanish, and Dr. Bird will finish us up. Thank you.
Hasta el 26 de enero se han confirmado 44 casos positivos de la variante Omicron. El primer caso del condado de Nueces se recolectó el 14 de diciembre. Las vacunas, especialmente los refuerzos, continúan ofreciendo protección. El número más alto de casos reportado hasta la fecha por COVID fue el pasado 20 de enero, con 1,581 casos en un solo día. En día promedio, en diciembre del 2021 se reportaron 65 casos, mientras que en enero del 2022 se reporta en promedio 824 casos. En lo que va del mes se han reportado 20,058 casos positivos durante la ola de la variante Omicron. La mayoría de los casos en edades de rangos entre los 0 a los 19 años. 35 fallecimientos se han reportado en lo que va del mes. Al día se reportan 235 personas internadas en el hospital con COVID, 51 de estas en unidades de cuidados intensivos. Más de 204,091 vacunas se han administrado en total, más de 29,000 han sido de refuerzo. De acuerdo a las pautas de los CDC, si usted resulta positivo a COVID, debe aislarse por 5 días. Si sus síntomas ya han desaparecido, puede salir de su hogar utilizando un cubrebocas por 5 días adicionales, a menos de que aún cuente con fiebre. Si ha estado expuesto a alguien con COVID y está vacunado, se le pide utilizar un cubrebocas por 10 días. Pero si no está vacunado, entonces se le pide aislarse por 5 días y utilizar cubrebocas por 5 días adicionales. Si cuenta con síntomas, tómese la prueba para determinar si se contagió. En cuanto a los tratamientos de anticuerpos monoclónicos, se ha demostrado que Regeneron es ineficaz para la variante de Omicron y ya no se usa como tratamiento contra COVID debido a la cantidad de casos de Omicron en los Estados Unidos. Sotrovimab ha sido aprobado y probado para combatir la variante Omicron, aunque los suministros son limitados. Las píldoras COVID-19 de Merck y Pfizer, que fueron aprobadas recientemente, ahora están disponibles en Texas. Los medicamentos deben ser recetados por un proveedor de atención médica. Durante la presencia de Omicron, las vacunas han provisto con protección al virus. Los adultos quienes no recibieron su vacuna son 5 veces más propensos a infección que aquellos quienes sí están vacunados. Las vacunas de refuerzo pueden ser de diferente farmacéutica dependiendo de la vacuna original que usted recibió. Las clínicas de vacunación continuaron ofreciéndose en el Centro Comercial La Palmera, en el Centro para Adultos Greenwood, en los outlets en Robestown, en el Centro Comunitario Hilltop en Annabelle, en la Casa de Corte del Condado de Nueces y aquí en el Ayuntamiento. También habrá clínicas en varias escuelas primarias del CCISD, incluyendo en Los Encinos para este viernes. Los detalles los puede ver en el portal www.cctexas.com/clinics. También le recordamos que habrá clínicas para la detección del COVID. Estas continúan en el antiguo Hospital Memorial de lunes a sábado desde las 9 de la mañana, así como en el Centro Cívico de Port Aransas de 10 de la mañana a 3 de la tarde este viernes solamente, y en los centros Amistad en Corpus Christi y en Robestown el día de mañana de 7:30 de la mañana a 8:30. Estos últimos solamente con citas.
Right, good evening, everybody. My name is Dr. Chris Bird. I'm here to speak to you on behalf of the Texas A&M University COVID-19 Informatics and Modeling team. We have two objectives: to answer your questions about COVID and to enable evidence-based decision-making on behalf of our local leaders. And we'll get right into the projections. I've made no changes to the projections again this week. There's two scenarios. In the red scenario, that's what was projected to happen if we didn't do anything to try to curtail the Omicron wave. And the yellow scenario is the one that if we did try to curtail the Omicron wave in a way that we reacted to the previous waves from the Delta variant and the Alpha variant and the original variant. So what you can see, the black data points, is that they're following pretty closely the yellow scenario. And indicating that we probably did successfully decrease the peak of this Omicron curve by wearing masks, by getting vaccinated, by social distancing, by doing all those things to hopefully stop and slow down the transmission of the Omicron variant, which is highly contagious. Now, you can see there's a lot of variation in the actual data points from day to day. Some days it can be only in the hundreds, and other days it could go up over 1,000. It's possible it might go up over 1,000 again, and we expect to see more variation, but we should be past the peak at this point. Okay, in terms of people in the hospital, again, we seem to be following more closely the second scenario, the more optimistic scenario, and I think that we're also, at least the projections are indicating that we're at the peak for the number of people in the hospital with COVID-19. Hopefully these numbers will start to come down in the very near future. And in terms of the ICU, there's good news that we didn't go up as high as what was projected, even in the optimistic scenario. So there seems to be less people ending up in the ICU than we had predicted, and that's definitely a good thing. Okay, going on to some other statistics. One number that we've looked at now and again is what proportion of the staffed hospital beds have COVID patients in them. This is that percentage that at the beginning of last year may have shut down businesses or rolled them back to 50%. 15% was that magic number. Right now we're at 22%. We expect that this is at the peak or near the peak also and should start coming down. But just to give you that frame of reference, you can go back through the different curves here, or the different waves. We have the Omicron at the left, the Delta before that, the Alpha before that in the winter of 2021, and before that the original SARS-CoV-2 virus in the summer of 2020. In terms of hospital vacancy, how many beds are available for people that need hospital care? Right now, we're at 8.9%. That's up by a little over 1 percentage point from last week. So that's moving in the right direction this week, but still quite low compared to most of the pandemic. ICU vacancy is also quite low and a little bit closer to about as low as we've seen it throughout the pandemic. Right now it's at 3.6%, but it's been down pretty close to 0% where all the ICU beds would have been filled. But right now, moving in the right direction, going to higher numbers. And this is a graphic that I showed very often about a year ago, and I look at it every once in a while, and last week I thought that it was worth looking at again. And it's very intuitive. You don't need to look at any numbers, just look at it. Red's bad, And if your gut tells you, you just use your gut to interpret this. More red is more bad. It's areas in Texas with how many patients in the ICU have COVID. So there are areas in Texas where there's a large amount of pressure being applied to the ICU by people that are sick with COVID right now, but not here in the coastal bend, luckily. But there are other places in Texas. So the pandemic's not over yet here, and there are places that are really feeling the effects of it right now in Texas. So in summary, the cases and hospitalizations should be past the peak, right around that peak value. And we projected that the peak for the cases was on the 23rd of January, and our projection for the hospitalizations was for them to peak on the 25th of January. The projected cases and hospitalizations, they're reduced by masking, they're reduced by social distancing, they're reduced when you get curbside pickup at the grocery store instead of going in. So that is a key take-home message. And just because the model predicted that we're just past the peak, it doesn't mean that it's time to take off our masks and celebrate that this peak is over, because if we did that, the peak wouldn't be over. So we have to keep doing these things to stop the transmission, slow down the transmission, because otherwise going back to normal prolongs the wave and it'll make it wider and not come down as fast. And remember, hospital vacancy is low, and our healthcare workers are strapped at this point. 2 straight years of this pandemic, there's a lot of healthcare workers that are leaving their jobs right now, which is making it so that our overall hospital capacity is lower right now than it was during the last few waves. So what can you do to combat Omicron? And we still need to do this. Avoid crowded areas in public, especially inside. If you can do that, you're going to reduce transmission rate. You're going to reduce exposure. 2, wear a mask. If you are around COVID, the mask helps to slow it down if you're around that virus. And it provides you protection against infection, regardless of whether you're vaxxed or not. 3, get vaccinated. Vaccination reduces the chances that you have really negative consequences from contracting COVID, especially if you get that booster shot. Lastly, isolate and get tested if you're feeling sick or if you've been exposed, and this will reduce transmission, which is the ultimate goal here overall. So thank you very much for tuning in this week. We'll go to a translation, and then the Public Health Director will answer any questions that there might be. Thank you.
Se estima que los casos positivos por la variante Omicron puedan llegar a los 3,000 diarios si las personas no toman ningún tipo de precaución, pero estos casos pueden estar al menos del 1,500 tomando las medidas precautorias de salubridad. En el área de la costa, los casos de pacientes pudieran ascender hasta 500 en los hospitales si no se toman medidas de salubridad. Tomando medidas, esos casos se mantendrán alrededor de los 250 y poco más de 50 de las unidades de cuidados intensivos. Las hospitalizaciones en hospitales del área han aumentado y hasta el 22% de las camas de hospital están siendo utilizadas para pacientes con COVID. Las vacantes de hospitales es de solo de 8.9%. Unidades intensivos se encuentran en el 3.6%. Los hospitales están contando con mucha presión en la fuerza laboral debido al alto número de pacientes. Esto es en total en todo el estado de Texas. Se estima que los casos pico estarán reportándose en esta semana. Las hospitalizaciones y los casos positivos se verán reducidos cada vez que se tomen medidas de salubridad, como el uso de cubrebocas, lavando las manos y desinfección de superficies, distanciamiento social, entre otros. Recuerden evitar ir a lugares con un alto número de personas. Utilice un cubrebocas, ya que su uso reducirá los contagios. Las vacunas también reducirán síntomas severos. Los refuerzos le darán mayor protección. Si cree estar contagiado, hágase la prueba. Si resulta positivo, aíslese y siga las indicaciones de su doctor, así como tratamientos. Si ha estado bajo exposición, también tome sus medidas de precaución.
Thank you for the translation. Are there any questions? Seeing none, thank you. We will see you next Wednesday at the same time, 5 p.m.